Hans from the University of Kentucky Markey Cancer Center, and I'm excited to share our work on improving cancer registry data with deep learning. Cancer is a major cause of death, and cancer registries are vital for tracking cases and outcomes. However, collecting data can be slow at a cancer registry because staff spend too much time reviewing documents just to confirm if they're cancer related. Our team trained a deep learning classifier on Kentucky pathology reports, outperforming an earlier model trained on Seattle data. This advancement means fewer reports need manual review, making data collection faster without losing crucial information. I hope you can drop by our poster to learn more about our work.
The goal of our work is to predict response to therapy for locally advanced breast cancer patients using a biology-based mathematical model and quantitative MRI data. The I-SPY 2 clinical trial is a multi-site, multi-subtype study that collected standard of care MRI data. And in 91 patients from this data set, our model predicted tumor cellularity and volume with correlation coefficients of 0.9 and 0.94.
Hello, everybody. Lucas Drescher from CSCS. Prognosis of metastatic melanoma has improved a lot over the last 15 years due to new immuno and targeted therapies. Yet not every patient is able to benefit from these new treatments. Fibroblasts in the vicinity of the tumor are thought to play an important role in mediating resistance. In this work, we will discuss how HPC can help to gain an interactive understanding of the tumor microenvironment on whole slide microscopy images, what algorithmic paradigms it enables, and how it could scale to a large patient cohort. Thank you.
Hi, I'm Abhishek from Oak Ridge National Laboratory. Our work tackles challenges in multi-label classification, focusing on primary site and histology in pathology reports. Traditional models often miss hierarchical relationships between labels. So we developed a hierarchical loss function to embed these constraints directly into the training process. Our results indicate this approach slightly improves logical consistency and accuracy for primary site classifications. Results are mixed for hierarchical classifications. Overall, this method shows promise for enhancing predictive accuracy and reliability in complex hierarchical multi-label tasks.
Unlocking the potential of AI in medicine hinges on access to vast amounts of high-quality data. But privacy concerns often stand in the way. What if we could advance research without compromising confidentiality? At our poster session, we introduced a novel workflow that generates synthetic pathology reports using 100,000 real cancer registry reports across 5 primary sites and 220 histology types. Leveraging advanced large language models and privacy safeguards, we have created synthetic data that mirrors real reports while protecting patients' privacy. We have rigorously evaluated our synthetic data on fidelity, utility, and privacy impacts, showing promising results that could accelerate AI advancements in healthcare. Curious about how synthetic data can revolutionize medical research? Join us at our poster session.
Our research uses deep learning to enable automated brain tumor detection, addressing aggressive nature and poor prognosis of brain cancer. By leveraging AI and improved parallelized CAN model, we identify the tumor characteristics, which is often missed in early stage. We aim to improve the detection accuracy and potentially saves life through the timely intervention. Thank you.
Hi, this is Abdul working on medical image analysis and AI application. So our research aims to develop deep learning models capable of identifying breast tumor locations without needing labels or manual reference points. So our approach has the potential to transform large datasets that lack annotation, making it easier and faster to analyze. Our model learns to find potential tumors, which can offer a practical solution for large-scale image studies. Thank you.
This study represents the first attempt to train a clinically relevant AI for medical imaging within a confidential virtual machine environment equipped with an NVIDIA H100 CPU. In this environment, a nodule detection algorithm for chest X-ray images was successfully fine-tuned. This secure setup is expected to reduce security-related concerns for both data providers and implementers.